So you have neck or back pain and this has been going on for as long as you can remember. And the pain kind of ebbs and flows. So some days it's not bad, and some days it gets so excruciating that you have to go to your MD. What happens when you go to the MD? You're given muscle relaxers and you're told to just take it easy and rest. Don't do any activity. But why is this actually harming you more so than doing you any good? And what should you actually be doing about it? We're talking about that and more in today's episode.
Welcome to Fearless Fridays, where we are talking about everything health and wellness related. My name is Dr. Melissa Chofi. I am the owner of New Quest Physical Therapy, a mobile practice serving areas in New York and Connecticut. There is so much misinformation out there in regard to the medical field, and with our healthcare model increasingly putting profits over patients, you as consumers need to be given all the tools you need to demand what you deserve, ensuring a strong, resilient, fulfilled, and fearless life. My goal is to empower all of you to stand up for yourselves and be able to call bullshit in a realm that is confusing as fuck. Let's get into the episode.
So what's the deal? The deal is full rest, unless you're bedbound, is never an option. You are never going to lie still in your bed doing absolutely nothing. So activity includes everything from actually doing like a balls to the wall workout to walking around your neighborhood, going up and down your stairs, doing your daily chores around the house. So you're not exactly resting. And the other component of that is that there is some way that you're moving and you're compensating throughout your daily life that is preventing you from moving in optimal ways, and which is why you're constantly re-injuring, or not even injuring, you're just experiencing this neck and back pain and you just want it to go away. So there could be a couple things that are going on with the reason why you're experiencing neck or back pain. So like I said before, we are under a load all day long. Your muscles might not have the endurance or the capacity to be able to withstand sitting all day if you're working at a desk, standing all day, walking all day, especially if you're compensating in ways for that pain. So a lot of people with neck pain, they'll either sit forward hunch like this, and that just compromises so many structures, and they're not using certain muscles of their neck. So then when they go to do something outside of this comfort zone that they're used to from sitting in all day, it's foreign to them, and their body is sending a signal that something's wrong, like we need to get out of this position. And pain is actually not always an indicator that something is wrong in your body. It's just a signal to your nervous system as a protection mechanism, and to try to get you in a safe place, even though realistically you're not always in danger if you're performing to the function or to the point of pain. Another reason why you could be perpetually in pain, or the pain's coming and going frequently, is because your body is just not used to being in certain positions, and it just doesn't have the range of motion that it needs to do some of the things that you're requiring it to do. And again, this could be a compensatory mechanism. So it's so used to performing in certain planes and within certain ranges of motion that when you push that limit, it's just going to repel and be like, nope, we're not doing that. So it's really important to realize what those limits are and then try to work up to them and then through them. So when somebody with neck or back pain tells me that their MD told them that they have to stop moving and basically lie like a board on their sofa for a few days to rest, it drives me insane, because this is actually doing the exact opposite of what you should be doing, or they should be doing. So what does motion do? Any musculoskeletal injury, so anything involving the muscles, the ligaments, the tendons, the joints in your body, anything like that that's painful, movement actually may make it feel better. So what happens when you're moving is that the synovial fluid in your joints is getting circulated, your blood is pumping, your nerves are gliding, and it just brings nutrition to those spinal segments in your neck and your back. And that's what we really need, because that is what's going to get you better. You just need to learn the ways to do that and the motions that are appropriate for you to prevent these problems from happening. And a lot of times people think that an actual position is harmful. So like if you're sitting all day, like that's the new thing, right? People are like, oh, well, I sit all day, so that's a problem. And I sit like this. So it's not the actual position. So if you're sitting like this for 10 minutes and then you shift, that's not the problem. It's prolonged positions are the problem. So we, again, need to be constantly moving. If you're sitting like this for 10 hours a day, yeah, you're gonna have pain. It's not the position, it's the lack of movement that's causing that. And like I said before, pain is not always an indicator that something is wrong. So let's walk through an example because I like to do that. So say your knee is bothering you and it's been bothering you for so long that you've learned how to adjust your movement and adjust your daily activities to account for that pain to kind of avoid it. So once maybe you had an injury initially, but like 3 months down the line, that injury heals. If you go to bend your knee, say that's what was giving you pain, you go to bend your knee 3 months down the line and that injury is no longer present, it might still hurt. And this is because your nervous system is like, whoa, what the fuck is going on? And it's just not used to that extreme end range of motion that you're trying to put it through. It doesn't mean that there's a problem. It doesn't mean that there's something wrong, I need to stay away from it. It just means that your nervous system is not acclimated to that type of movement. So it's just afraid it needs to learn that new movement system. It's not a threat. It just needs to be taught that it's not a threat. So the nervous system is very smart in that it picks up on little signals like that and it tells us when to stop doing things that might be a danger to us. Even though it's not always a danger, it might be a danger. And then once we retrain it and we kind of like use that mindfulness that we talk about, our breathing gets incorporated, we really pay attention to what's going on and we purposely try to move through that painful range, the nervous system eventually acclimates to that and then that range is no longer painful. And this is really confusing and it like you might have to watch it a couple of times to actually understand it. But the point being, pain is not always an indicator that something's wrong. It just means that the nervous system could be confused and is not really, it doesn't have that roadmap like we talked about last week as to what you can do versus what you're afraid to do, if that makes sense. I also don't know why we neglect how important stress and the lack of sleep are when we're experiencing pain, because both of these actually contribute to the signals that are going through your nervous system and those pain signals that you're experiencing, because everything's in hyperdrive, especially when you're stressed out. Everything's in hyperdrive. So you have to be really mindful of what's going on and think of ways that work for you to combat that stress. So then, like I said, maybe breathing, maybe meditation, maybe just journaling, and just really being mindful of all of that, and then paying attention to your sleep schedule and having an actual sleep or a bedtime routine to get you to relax and go to sleep might be helpful. Again, all this should be done in addition to actually moving and actually doing exercise. So when I say exercise, not all exercises are created equally. An exercise for you during your time of pain might just be neck rotations. It might be looking up and looking down, something as simple as that. It might be for your lower back, bringing your knees to your chest. I'm not talking about running to a CrossFit box and going ape shit on like med ball slams or anything like that. I'm talking about like movement, gentle movement, getting your body back in the game and getting acclimated and then working up to your prior level of activity. So once we feel better and then you're getting movement and your neck is feeling pretty good and your back is feeling pretty good, we want to push the limits of exercise without actually killing ourselves. So like I said before, and I've said it so many times and you're probably sick of hearing it, but our bodies, we need to get used to loading them. We need to get used to putting them under an appropriate amount of stress, because some stress is good, too much stress is bad, just like chocolate cake, right? But yeah, so we need to appropriately challenge and load the structures and the body and just and like just accommodate to our daily lives. And this is really, really important. You need to be progressive with your programming. You need to be appropriately challenged. Write stuff down. Say what weights you were using. Say how many repetitions you did. Say if you were holding an isometric, how long you were doing it. And if all of this sounds foreign to you, that's okay. Realize that we are here to help you. Physical therapists especially, we are so well trained in the musculoskeletal system and appropriately diagnosing and prescribing exercises that are appropriate for you. One of the big things that I work with a lot of clients who have perpetual chronic neck and back pain, and we get them moving. That is the most important part. I have never ever just worked on a patient or client passively and just done massage and just done joint mobilizations and just done passive stretching with them. And I actually had one client one time when I was working in a traditional clinic a couple of years ago, and my director told me not to give her any exercises. And of course, who are we talking about? I challenged it, and she said, nope, don't give her any exercises because she's going to complain. Whatever. So she did not get better because she didn't know how to move. She constantly, she would feel great after the soft tissue work and the mobilization, but she would walk so guarded because she just didn't know how to move. So that's the only patient that I've ever never seen a result from. And let's not get into the reasons why that had to happen. It is one of the reasons I left. But yeah, so my point being that you need to relearn and you need to retrain your body. You go through, and people get frustrated because they're like, I feel like I'm learning to walk all over again. And you really are, because over the years, your body picks up these compensations. It goes through a lot of shit. Like, life is hard. We know this. And your body picks up on ways to adapt in the most efficient way for it. Not meaning it's always the best way. It's just always the most efficient for it at the time. And we just need to constantly be giving it input and giving it redirection, just like we would a toddler who's trying to learn to walk. So don't take that as a sign of weakness. Just take it as a sign that things can progress and change, especially when you work with a professional and one of us who can help you get to that point. So guys, next time you're having one of those crazy neck periods or lower back pain periods where you're just in excruciating pain and somebody tells you to take a muscle relaxer and rest, I hope my face pops up in your brain and you remember that resting is doing the opposite of what you should be doing, because resting is not going to do anything. You're going to continue to experience this pain unless you actually do something active about it. So what's appropriate for exercise is very confusing, and I know I threw a lot at you, and also everybody's very individual. So if you're having arthritis in your spine and Judy down the street is having arthritis in her spine, you two are going to be given very different exercises to do depending where you're at and what you're capable of. So if you haven't worked with a professional, I really, really urge you to seek out a good physical therapist where you're actually spending time with a physical therapist, and I mean more than 15 minutes, because they're the ones that are going to accurately give you an exercise program and progress you and get you to the point where you don't have to rely on muscle relaxers any longer, because who the fuck wants to do that? Not all exercise is created equally, as we mentioned before, so we don't always have to go balls to the wall. Simple motions, sometimes we'll do it. We just have to build upon that. We need a starting point and we need an ending point, and we need stuff in the middle to progress us to that end point so that we prevent shit from happening all around. Just keep educating yourselves. Demand a life that you deserve. Ask questions, and most importantly, stay fearless. And we'll see you next week.